Hello everyone. Today we are going to learn about a very important and of course nowadays common neurological disorder, what we call as multiple sclerosis. See, multiple sclerosis, the disease is very common between the age of 20 to 40 years, and it is more common in females in the ratio of 3 times it is more common. Basically in the brain we have the covering of the nerve, what we call as myelin. If you can see this is the brain, and this is a nerve cell, and there is a covering, what we call as myelin sheath. In multiple sclerosis, what happens is, due to some autoimmune mechanism, our body cell themselves attack this myelin sheath. This myelin is very important for conduction of impulses very fast. Like when we see, we want everything to be fast happening as we are doing the movement, we are talking, we are perceiving the sensations. But if you see the next slide, if you see, the signals are transmitting very fast, but when this myelin sheath is damaged due to antibodies, these are damaged by various T cells and macrophages. When they are damaged, the conduction of impulses happens very slowly, and that's where the manifestation of disease occur. One thing is very important, we don't know what exactly causes this multiple sclerosis, but what we know is it's an autoimmune phenomenon. Various aspects have been found out, that like viral infection is there, sometimes the environmental factors are there, sometimes the junk food which we are eating, and nowadays very important, they have seen the levels of vitamin D was very low in many of the subjects. That may also trigger a multiple sclerosis. So what are the symptoms of multiple sclerosis? If you go head up and down, if you see eyes, suddenly loss of vision in one eye can occur in this case, and sometimes blurring of vision. This is one thing. Second thing is double vision, imbalance of walking, and slurring of speech. That's another thing which can occur in combination. Third thing which is seen is numbness or hyperesthesia, that is what we call as increased sensation in one half of the body. That's a third thing. Fourth thing is weakness of one half of the body, or commonly when it affects the spinal cord, we get weakness of both the limbs, lower limbs, or sometimes all the 4 limbs. In addition to our bowel and bladder incontinence can occur. Usually the disease, when it occurs, why we call this as multiple sclerosis? Multiple means it affects multiple location, and sometimes it occurs, most of the times, multiple times, and it's always a relapsing remitting course. When the disease occurs initially, it is sometimes limits itself, or we have to reach the doctor. And who is the right doctor to be reached is a neurologist. When these symptoms which I have discussed, if you happen to have such manifestations, the first person to reach out is a neurologist, who, along with the diagnosis of multiple sclerosis, he will rule out other mimics which can have similar signs and symptoms. Once he ascertains the diagnosis of multiple sclerosis, when an acute symptom is there, then they give what the drug called as IV methylprednisolone, that they give it for 5 days. Usually most of the people, they subside. Only important thing is the chances of relapse are very common in this case. Sometimes once a month, sometimes 3 to 4 times a year, this can happen in this disease. That's why, and every time it happens, if you don't start treatment early, it builds up, and you can have residual deficits, or patient can go in for depression, various mood swings, spasticity, and movement disorder. Sometimes they may be bedridden. But the positive aspect nowadays is the treatment of multiple sclerosis is available. Initially we had only injectables. Now more than 10 different medicines, injection plus oral tablets are available, which when we are taking regularly with the consultation of the neurologist, the recurring problem will significantly decrease, and the disability also decrease, because the people who are not taking treatment, they have memory problems, cognitive dysfunction and residual dysfunctions which are there. Second important aspect one should understand in the treatment of multiple sclerosis, as far as other neurological conditions are also there, we want a holistic approach. The lifestyle modifications, regular physical activity. Basically, you have to invest 1 to 1.5 hours on your body to see that your body becomes healthy by regularly walking, exercises, and the most important nowadays is yoga has got a tremendous role, particularly pranayam and, like you see, breathing techniques of art of living, Sudarshan Kriya. It also has got benefit in preventing the recurrence of multiple sclerosis. So you don't have to worry. Reach the doctor, and early treatment will have definitely a long-term benefit. Thank you so much.